Information becomes transformation. I'm Dr. Ferris Corbett, alongside my Welcome to the Health Talk podcast, where evidence meets encouragement and information becomes transformation. I'm Dr. Ferris Corbett, alongside my colleague, Dr. Deidre Willis, and we want to thank you for joining us today. We don't take it lightly that you've chosen to spend this time with us. Here at Health Talk, our goal is simple: to provide you with clear, trustworthy, and practical health information so that you can make informed decisions about your life, your wellness, and the well-being of those you love. From public health to mental health, from prevention to healing, we believe knowledge is power, but wisdom is action. And together, we'll explore both. So, settle in, open your mind and heart, and let's take this journey toward health, hope, and wholeness together.
Good evening, everybody. How is everybody doing tonight? Listen, welcome. I am so glad that you are here with us on tonight. Yes, I am. Yes, I am so glad to have you here. We are super excited about tonight's episode, okay? And we're glad you're taking this time to join us here. So, do me a quick favor. Go and tell somebody. Like, tag, share, tell somebody. Health Talk is on the line. You heard it right here. Health Talk is on the line. So make sure you get the word out to somebody. Tell your friend, tell your family, loved ones, whomever, let them know that Health Talk is on the line. Okay. We want to bring you a very good topic on tonight. And I am so glad and so grateful that you have decided to be a part of our discussion on tonight. Now, do us a favor. Let us know. Drop us a line in that comment section. Let us know where you're watching us from. We'll love to hear that. And again, we want to take this time and this opportunity to say welcome. All right. So, are you ready? Good. I'm glad you're ready because I'm ready too. All right. So let's get going here tonight. So, good evening, my family, my friends, and all of you. And welcome back to another episode of Health Talk. I am Dr. Ferris Corbett, and I'm here to bring you another episode of Health Talk. Okay. Now, tonight, we are turning our focus on an issue that is making national headlines, and that is the turmoil inside the U.S. Department of Health and Human Services. From reorganization plans and leadership shakeups, reports of workforce frustration, many are asking, what happens when politics collides with science, and how does that affect the public's trust? Proverbs 11 and 14 remind us, where there is no guidance, a people falls, but in the abundance of counselor, there is safety. Leadership and trust in health agency aren't just policy matter. They're life and death issues. Okay? So that's something to think about. It's not that it's a life and death issues. And tonight, here on Health Talk, we're going to talk about that. All right. So join us. Come on. All right. Take a moment. Go tell your friends. Go tell your loved ones. Gather your family around. Let's have this discussion. Okay. Thank you for joining us. All right. Let's talk about it. So, did you know that trust in the federal government has dropped to below 20%? And this is one of the lowest level in modern history, according to Pew Research 2024. And when it comes to health specifically, a survey done in 2023 found that 40% of Americans doubt government health agency to provide them with uh, information that is unbiased and that is science based. 40%. pretty high number. And among healthcare workers, nearly 1 in 3 individuals reported frustration with political interference in health policy decision. We need to talk about that. Okay? Trust, that's the glue to health. And without it, even the best science cannot save lives. Let's talk about it here on Health Talk. Why? Because your health matters. Tag someone, share it with someone. Let's have this discussion on tonight. Now, report shows that tension at the HHS is leadership reorganization is creating uncertainty within the organization. Uh, Workforce protests over burnout, morale, and political directives, and even questions about whether science is sidelined or being sidelined by politics. So this is something to think about. Okay. Now, one of the things that HHS does, it oversees the organizations such as Medicare, Medicaid, the FDA, Food and Drug Administration, the CDC, uh, Center for Disease and Control, and the NIH, the National Institution of Health. Okay, the HHS department oversees all of these agencies: Medicare, Medicaid, FDA, CDC, and NIH. All right. And these particular agencies, they are the backbone of the health infrastructure within the United States. So when turmoil begins to hit at the top, that effects ripples down to areas such as hospitals, clinics, and communities. So it just doesn't affect those agencies. It affects all of us. All of us are affected by this here. So we're here to provide you some information to bring an awareness, to increase and raise the awareness. All right. So here, for example, take this for example. If scientists feel muzzled, then research slows down. And if the workers, if they feel like they're being ignored, if the morale is just done plummeted, or and what happens is quality suffers. Eventually, ultimately, what's going to happen? The public starts asking this simple question: can we trust the health advice we're being given? Can I really trust the health advice that I'm being given? So that's the reason why this is an important topic, and we need to talk about it, okay? And listen, I am glad you're here with me so that we can have this discussion together, okay? Thank you for joining us. All right, let's keep moving on into tonight's discussion. All right, this tension within the HHS, let's make this very clear that this is something that is really is nothing really new. Okay, so let's be real about it. So it's not new. We've seen it when COVID-19, the pandemic was around, when it came to wearing masks and when it came to being vaccinated, it became a political football. People, you know, used it as a political platform. Uh, Not only that, we also seen this when it came down to opioid regulation. Okay, where the pressure from industries helped to shape the policy that the lawmakers made. And we've also seen it in women health and reproductive rights, where science often collides with political agendas. So what we're seeing happening now within the HHS agency is really nothing new. Like I said, we saw it in COVID, we saw it in the opioid regulation, and we saw it when it came to women health and reproductive right. Um, we've seen it then. This is just on another level. And so the problem now is that when politics drowns out science, the public loses faith. Okay? And when faith in the healthcare system begins to erode or vanish away, so does compliance with things such as vaccines and treatments and those preventative measures. So when we erode that trust, when we cause that trust to come into question, or when that trust becomes more politicized, what happens is we see a decline in all sorts of compliances, like we said, such as vaccine, preventative measure, and treatments. So this is not just about Washington. It's not just about what's going on in DC. It is about what's happening in your doctor's office, in your pharmacy, and in your community. So we can't just look at it from a issues that is occurring in Washington D.C. Let's broaden our scope and let's look beyond the political arena that is occurring in Washington D.C. and let's look at what's happening in our very own uh, primary care providers' offices, what's happening at our pharmacies, and what's taking place in our communities. So let your focus or your mind or your view go beyond that. What's happening up in Washington D.C. Think about what's happening in your own neighborhood with your own healthcare providers at their offices and even at your local pharmacists. What's going on there? Okay. Now, behind the scenes, the workforce is struggling. Okay. Now, you got burnouts after years of having COVID and multiple emergency responses, the flooding, the and things of that nature. Also, the distrust of leadership when politics and collides with science. It just begins to make things more challenging and more difficult, and it like we say, it erodes the trust that people have when it comes to uh, things or information that is coming from the healthcare organizations and things of that nature. And it also is cause exodus of talent. People that had years of experience are now leaving uh, the agencies such as the HAS, Medicare, Medicaid, the CDC, the FDA, and the NIH. Scientists and analysts and statisticians that have been doing this for years and have all the experience, they're now starting to walk away from this, all because of the political tension and the collision that is taking place within these particular agencies. So when the people who are charged with protecting us and protecting our health, when they begin to feel silenced or unsupported, the system becomes vastly weakened. And without a strong, motivated workforce, even the best of policy falls flat. So let's think about this. Again, I'm encouraging you to broaden, widen, increase, expand, whatever terminology you want to use, your focus beyond the political side of it, of what's occurring in Washington, D.C., and think about this the next time that you go to your local pharmacies. Think about this the next time you go to your primary care provider for an office visit. Okay. And you think about this, what's going on within your local communities, right around your neighborhoods. Okay. So this is bigger than Washington. I know some of us don't want to think of it as that or see it as that. But trust me, this is bigger than Washington, okay? Because everybody, every human being is in some way, some shape, some form, some fashion, will are impacted by what's going on within the HHS. Okay? Think about that. Think about it. So we're here to bring the awareness to you, to provide you with a lens to look through that you can see beyond that which is being presented, that cause you to do some critical thinking and to do some critical reasoning and looking further than what is being presented, and think about you. Think about how will impact you, your children, your grandchildren, and even down possibly to your great grandchildren. Think about that. So we're here to bring that awareness to you so that you can look through a different lens and from a different perspective. Okay. So again, as we say, public trust in the HHS, it, it's the public trust is the foundation that makes health effective. And if that trust in any way is broken or torn, or if that trust becomes eroded, then the effectiveness of health and health care become compromised and it begin to diminish. And if we're not very, very careful, it may just become totally eradicated. So let's think about that when we are having our discussions. Um, let's look at it from every angle, okay? Not just through a one sided lens. All right, so think about it. So without trust, without having that trust, vaccination campaigns fails. Without that trust, preventative measures become totally ignored. And without that trust, misinformation fills all those little gaps. Okay? Those misinformation plugs in on those little holes and those little gaps. So that is why we're here tonight on healthcare, is to try to help fill in those gaps, not with misinformation, but with evidence based scientific um, information so that you can make an informed decision about what it is that you believe and what you take trust in. Okay. So it has nothing to do, we're not here on a political spectrum, but we're here to bring awareness. We're here to present scientific evidence. We're here to provide evidence based information, okay? So that, again, you can make an informed decision, okay? A critical thinking analysis in terms of what is going on within the HHS. Again, I would emphasize to you, this is nothing political, okay? No politicalization in any way, shape, form, or fashion. We're here just to provide with basic facts, basic truth, so that you, as an individual, as a collective community, and as a family, can make informed decision. Okay? All right. So again, without trust, vaccination campaigns fail. Without trust, you see preventative measures are ignored, and without trust, misinformation fill in all those little gaps. Now we saw this happen during the COVID pandemic. We saw it during, and we're seeing it now during the resurgence of measles, and we will see it again this RSV season, okay? And the flu season. They're coming up. Next month marks the beginning of the RSV and flu season. And keep in mind, there is another strand of COVID out there as well. So unless trust is rebuilt, we're headed in for a potential rude awakening come this flu season and this RSV season because of the politicalization that is occurring within the agency of the HHS. Okay, so think about that, people. I'm not here to try to do a scare tactic or win any type of political points or to prove my point or anything of that nature or to provide you with my personal opinion. I'm just here to provide you with facts, evidence, scientific based facts so that you can make a decision that is informed. Okay? So trust is not about perfection, as I always say. It is about transparency, accountability, and communication. And I'm here trying to communicate this to you the best way I can. I'm trying to be as transparent as I can, and I'm trying to show forth accountability to do my part as a public health practitioner. Okay? All right. People, they will forgive mistakes, but they do not forgive deception. And we're not here to deceive you in any way. Okay. So, as citizens, what can we do? Not only as citizens, but as professionals and as communities. What is it that we can do? One of the things is that we demand transparency. Ask our leadership for clear, evidence based update, not one's opinions, one's thoughts, but what does the evidence says? Demand that transparency. Number two, hold the systems accountable. Push for uh, policy driven by data and not by politics. Hold the system accountable. That accountability. Push that policies be made based on and driven by um, statistics and data that are factual and not having to do anything with uh, politics. Okay. Number three, stay focused. Um, check multiple credit credible sources. Stay informed. That's what we're here on Health Talk to provide you as one of those credible sources. So check credible sources and stay informed, stay up to date, see what's happening, know the facts, know the truth, know the scientific base and the scientific facts and the evidence-based facts. Okay. And number four, be a bridge. Okay. Share accurate information with your family and within your networks, within your communities, within your church. Be a bridge. And that is why Dr. Willis and I are here as a part of He Cares. We're trying to be that bridge. We're trying to show forth that transparency. We're trying to hold the system accountable, and we're trying ourselves to stay informed. That's why we do these researches. So that when we bring you this information here on Health Talk, we're not just bringing you just something to be bringing you. We have done research. We're bringing you evidence based facts, data, statistics, and things of that nature. Again, so that you can make that informed decision. All right. The incentive here is clear. Rebuilding trust saves lives. When community trusts the health system, then the outcome begins to improve. So we got to build that trust. And that's why I'm here trying to get that trust built because we want to provide you with that evidence base. Okay. Now, this is a part. that I want you, our listening audience, to take a part and join in with us. Okay. All right. Again, if you're watching us, please leave us a note. Let us know where you're watching us from. And take a moment and tag somebody in. Share this information with somebody. This information uh, is to bring to you information to help you make an informed decision. Okay? So the first question we're going to present to you tonight is in the chat. You can respond to us in the chat, in the comment section. It is, how much trust do you currently have in federal health agency? Okay. So our question tonight, the first question we're going to present to you tonight is, how much trust do you currently have in federal health agency? Leave us a comment in the chat area. Let us know what your thought is on that. And if you're uncomfortable with leaving your thoughts in the chat area in the comment section, shortly here I'm going to provide you with information that you can uh, present that response to us uh, through He Cares Training Education Center. Okay. Now, the second question we're going to present to you tonight is, on a scale of 1 to 10, how confident are you that science guides health policy today? And what would make that number one number higher? What could do, what could be done to make that one number higher? So on a scale of 1 to 10, how confident are you that science guides in helping health make health policy today? So basically, we're asking, the question is, how much confidence do you have on a scale of 1 to 10 that the health policies and decisions that are being made are done on scientific facts? Okay. Again, on the scale of 1 to 10, how confident are you that science is guiding health policies and health decisions that are being made today? And what could make that number one number higher? Okay. Again, we want to know your decision, your thoughts. Let us know. Put it in the chat area, put it in the comment section. And if you feel uncomfortable in responding in an open forum like this here, then we will provide you in a few minutes uh, a place where you can confidentially uh, drop us a message at He Cares, and we would love to hear your thoughts on these questions. Okay. Our next question is, when you hear conflicting health messages, how do you decide what to believe? So when you hear one source says this and another source says that, when you hear these conflicting health messages, how do you decide what to believe? Leave us a response down there in that comment. We would love to hear your response to that. Okay? And not only would we like to hear it, but what you say can very well help someone else. So if you have a strategy or a means of determining when you hear conflicting health messages, how do you determine what to believe? Okay, what do you base your decision upon? All right. And our last question that we would like to present to you, and we're going to put that in the chat again. Please go ahead into the chat area. Give us your response. Let us hear your thoughts. We would love to hear your thoughts. And not only would it be beneficial to us, but it would be beneficial to someone that is watching or someone that might even catch this on replay. So, the last and final question we want to present to you tonight is, what role can you play in helping your family or community separate fact from politics? Okay. Again, what role can you play in helping your family or your community separate fact from politics? Okay, we would love to hear your thoughts. Go ahead and leave us a thought down there in that chat, that comment section. Fill it in. Let us hear what you think. Okay, let's recap these questions one more time. Okay, again, how much trust do you currently have in federal health agency? How much trust do you really have in federal health agency nowadays? Leave us your thought in the chat, in the comment section. Let us hear. Okay. Our second question is, on a scale of 1 to 10, how confident are you that the health policies are being made by science? They're being guided by science and not politics. Okay? And what could be done to make that number go up by 1? Okay? Our next question would be, when you hear conflicting health messages, how do you decide what to believe? Share your thoughts with us. We'll love to hear that. Okay? Do that for us. We love to hear. What are your thoughts when you hear that? And lastly, it says, what role can you play in helping your family and your community separate fact from politics? All right? Leave us your thought in the comment. Okay? We would love to hear what your thoughts are on the matter. All right? Now, again, those questions, they're not question of judgment. They're not a got you type of question. They're not a put you on the spot type of question. No, they're none of those things. They're just reflection questions. They're questions to cause us to reflect, to think, to process, to analyze, and things of that nature. Trust starts with having a dialogue. That's what we're here doing. We're having a dialogue so that you can trust the information that you hear from whatever health source. But we want that source to be based on evidence based research. We want it to be based on scientific facts and not be motivated by any type of political spectrum. Okay. Now, at He Cares Training and Education Center, we know that public trust is the foundation of public health. Okay. So that's why at He Cares Training and Education Center, we offer to you evidence-based workshop for communities and organizations as well as ministries. Okay. We also at He Cares Training and Education Center provide faith-based health coaching to help people navigate uncertainty but with confidence. Okay. And we also partner with school, churches, business to strengthen communication and trust. Because trust does not just happen, it is built one conversation at a time. We're here having that conversation tonight. And guess what? I'm glad that you're here having that conversation with us, okay? Listen, the turmoil at HHS is not just politics in Washington. It is about trust in science, it's about trust in the health system, and it's about trust in people sworn to protect our well being. Okay? So, again, let's broaden your focus. Let's not look through a one sided lens. It's not just about politics that's going on in Washington. As I said, it's about what happens at your doctor's office when you go for your visit. It's about what happened when you go down to your local pharmacies to get your medication. It's about what's taking place in your very community. So when trust is broken, lives then are put at risk. As we said, without trust, vaccination campaign, all those things, they begin to fail. Without trust, we talk about preventative measures become ignored. And without trust, misinformation fills in all those gaps. But tonight, we're filling in those gaps with evidence based research and scientific facts. Okay? So when trust is broken, lives are put at risk. We must begin to rebuild that trust. And when we rebuild that trust, communities then begin to thrive. Okay? Proverbs 28 and 18 reminds us, where there is no vision, the people perish. Vision, leadership, and integrity are not optional in health, they are essential. Okay? All right? Think about that, people. Family, I just want to bring you truth. Just want to be transparent. I just want to be held accountable. That's what we're here for tonight. Okay. Again, I want to say thank you. Thank you so much for joining us here on Health Talk. And remember, if any of those questions that we presented to you tonight, if you're catching us live, and any of those questions we presented to you tonight, you feel a little uncomfortable with giving your response in a public forum, in a public setting, we're going to put on the screen here in just a minute in the chat area, in the comment area, a way that you can respond to those questions if you're watching it live and if you catch us on replay. Okay. So to get in touch with us, you can go to our website. Our website is there on the screen, and in the chat area, it should be a hyperlink. You can click on that hyperlink, and it will take you to our website. And from there, you can leave your response. You can leave us any comments you have. You can also request any type of episode that you would like presented here on Health Talk. So go ahead, click on that hyperlink in the chat, reach out to us if there's a particular episode you want to see, if you want to respond to the questions that are in the chat area and you don't want to respond in the public forum, you can go to our website and you can respond there. Dr. Deidre, Dr. Willis, and I, we would love to hear your response. Trust me, we would love to hear it so we can further this dialogue, we can further our conversation. Okay, again, if you want to reach out to us for any of the services that we provide at He Cares Training and Education Center, our email address is there as well. And again, you can go to our website and you can request a particular service, what it is that you would like for us to help you with and to meet your needs. Okay. Again, thank you, thank you, thank you, thank you, thank you so much for joining us here tonight on Health Talk. And if you don't mind, do me a huge, huge favor. Please make sure you take a moment and tag someone in this. Like this video, share this video. Okay? So do me that favor. Take a moment, please like, share, subscribe. Okay? If you're not following us on our Health Talk Facebook page, please head over there and follow us on our Health Talk Facebook page. Make sure you share. And if you're not subscribed to our Health Talk YouTube channel, please head on over there to YouTube. Go ahead and make sure you hit that subscribe button and make sure you also hit that bell so that you can receive notification each time that we upload and present new material or when we come on live. And also, please make sure you give us a like and make sure you give us that thumbs up. All right? Please do that for us. Again, share, 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 like, tag, share, subscribe, all those things. Please do us that favor. Make sure you take a moment, share this with somebody, um, like, share, tag, subscribe, all those good things. Please do so. It helps the channel. Make sure you give us a thumb up as well. Okay. All right. We appreciate you. Thank you so much for taking your time to join us here tonight on Health Talk. As Health Talk is a part of He Cares Training and Education Center, where yours truly, Dr. Corbett, is the CEO and founder, and Dr. Deidre Willis is our executive vice president and our co-founder. Please make sure you share this with your colleagues. Make sure you share it with your friends, your family, or anyone concerned about the future of public health. I think you will find this information that we presented very, very valuable. Again, leave us your comments to the questions that we presented. They are in the comment section. Please go ahead and give us a response there. We would love to hear what you have to say. Reach out to us. Go to our webpage. I will put that website address up there one more time. Again, please go to the website and let us hear from you. We would love to hear from you. All right. So, again, thank you so much for joining us. And if nothing happened, we will be here tomorrow night with another episode of Health Talk. Again, thank you for joining us. I am Dr. Ferris Corbett. along with my colleague, Dr. Deidre Willis, and we're reminding you that health is hope and hope is healing. All right. Thank you to the highest for joining us again. Until tomorrow night, nothing happened. The Lord's will. We will see you tomorrow night. And until then, God bless. You have a wonderful night. If you catch this on the replay, go to those comments. Please respond to those questions there in the comment section. Let us hear from you. We would love to hear from you. If you need us to reach out to us for any type of services, the chat, the comment section has our email address. Go ahead, click that hyperlink in there. It'll take you to our website. You can go ahead and request your services that you would like for healthcare. He cares to provide you. All right. Thank you again so much for watching us. Until tomorrow night, we will see you until then. Be blessed.